This is Sridharan from SNS College of Physiotherapy. So in this video, we're going to see about the topic based on epilepsy. So the epilepsy is a neurological disorder mainly affects 1% of in the global population. So defining epilepsy. So what is epilepsy? So epilepsy is an unprovoked seizures that spaced for more than 24 hours. It is known as epilepsy, and it is also an risk assessment is one seizure can also an high risk for the occurrence more than about 60%. It is an high risk recurrence for up to 10 years. And diagnostic tools, the diagnostic tools of the it is an clinical history we can able to diagnose it, and as well as also EEG and also a neurogenic imaging confirmations can able to identify the causes of epilepsy. So etiology means causes of epilepsy. So what are the general causes for the epilepsy? We're going to see that. So in genetical mutations are the one of the major causes for an epilepsy. So and as well as also some of the structural and infectious causes can also cause an epilepsy in the persons, like that some of the structural causes like as tumors, stroke, encephalitis. So these are the some of the causes, structural causes for the epilepsy. And infectious causes like some of the diseases for a prolonged period of time can able to also causes the epilepsy in the persons. So epidemiology. So prevalence for the epilepsy is so majorly around worldwide. Moreover, around 50 million people population around the worldwide is caused by the epilepsy. So incidence is per year for per 1 million people there are around 40 to 70 cases were around the worldwide, which majorly covers on the old age and as well as also old age persons. So the mortality rate, if the person is caused by epilepsy, the mortality rate is also in a high in nature, and the geographical variations more common in low and middle income countries, nations were be majorly affected by the epilepsy. So pathology of epilepsy is, so how can the epilepsy just enters and it finally reaches a causative state. So first, they are typically in the temporal lobe epilepsy with hippocampal sclerosis. So in the hippocampus, there is an area in the brain which is known as hippocampus. If the sclerosis is formed around in that region, it may causes the temporal lobe epilepsy, and the abnormal brain development can and also a glial tumors can also causes the epilepsy in the patients. So as well as also AVMs, which is an avascular malformations can also causes the seizures, which is via ischemic and also bleeding. Ischemic means if there is an if in that region if starts and bleeding, and that region if doesn't get a proper blood supply is known as ischemia, or else if that region leads to bleeding, these two kind of nature can causes avascular malformations in the brain, which finally leads to epilepsy. So investigations. So how can we diagnose if the person is caused by the epilepsy or not? By using investigative methods. So first one is EEG. So EEG is electroencephalograph, and then MRI scans, and then blood tests, and finally we can also using genetical tests. So using these kind of investigative factors, we can identify if whether the person is caused by epilepsy or not. So initial management strategies for the epilepsy are, first we have to diagnose and classify whether what kind of epilepsy is that causes the person, and then we have to educate the patient first around what is epilepsy and what is the nature of epilepsy, and as well as we have to and we also have to educate the surrounding environmental factors and also the persons around the patient who is affected by the epilepsy. And third, we have to change a lifestyle modification for the person who is caused by the epilepsy. And finally, we have to also teach them an seizure first aid. So in seizure first aid, we have to educate them with protect the patient, and also it has phases that provide safety measures which are caused by the epilepsy. So what are the pharmacological management? So pharmacological, which is management, which is majorly plays a major role in the management of the epilepsy. So first we going to educate the patient by using the common medications. So these are the some of the common medications which can be prescribed for the patients who are affected by the epilepsy. And we also have to go for a drug selection based on the what types of seizure is having the patient, and according to their age, and as well as also according to the side effect of the person or the patient gets to it. And finally we have to go on monotherapy. So monotherapy is mainly concentrated on the side effects that going to face by the patients. And lastly and finally we are going to see about the combination therapy. So how can we combine our medication and as well as also drug and along with some other management techniques, and giving the multimodal type of management which focuses for the patients who are having the epilepsy. So finally we will going to some management which based on the surgical and some other therapies. So first resective surgery, it is mainly helps in the patient who are having the seizure, focus on the particular area which is affected through the brain. And second we going for a vagus nerve stimulation. So one of the major technique we are using in the patients to treat the seizures. And then we third we are going to give them an responsive neurostimulation, and finally we have to prescribe them with a ketogenic diet. So these are the some other management and the surgical management that have been given for the patients who are affected with this epilepsy. So thank you.